I'm Stephanie Haskins, co-founder and CEO of Debtle. We've all heard the heartbreaking stories of people who have dealt with America's most hated industry. I'm talking about debt collections. When I worked in healthcare finance, I was shocked at the number of patients that would call the healthcare system desperately trying to negotiate their own overdue patient debt. And so that's what inspired me and my co-founder, who's my husband, Houston Haskins, to develop Debtle. Every year, 93% of all businesses will see at least one customer who doesn't pay an invoice, and 40% of all patients try to negotiate their own medical bills directly with their providers. Debtle is a cloud-based software that enables organizations to discount and negotiate overdue customer invoices directly with their customers. So Debtle works basically in 3 easy steps. Our clients choose the accounts, then we work with them to automate discount programs, develop discount programs, and then even turn on a negotiations option so that they can enable their patients or customers to counter offer. And then from there, we use a variety of innovative payment methods, things like opt-in to payment plans, to resolve that balance frictionlessly for our clients and their customers. So Debtle is on a mission to tackle the consumer debt crisis that impacts over 85 million Americans annually who struggle to pay at least one bill. The results for our clients are an improvement in revenue, a decrease in expenses and overhead, an improved patient or customer experience, and a positive impact to their local community because debt collections can significantly impact credit. We've talked with people who have had their wages garnished. They've been sent to jail because they were unable to pay their son's pediatric cancer bills. So the impact at the macroeconomic level can be very significant.
So I have a question in terms of like the stage. When do you enter, as a parent with a child that has exorbitant medical bills, where do you enter in the process? Because I know hospitals, they offer plans and payments, and I'm just wondering where you are in the process.
So where Debtle works in the process is after a bill has become overdue, but before it gets sent to collections. So what we're doing is enabling organizations to bring that piece of it in-house. Because right now, organizations, they use debt collectors because they think that's the easiest, most efficient thing for them to do. But debt collectors only return between 4 and 8 cents for every dollar that you send to them. And they keep 25 to 50% of what they collect. And so now with advancements in data analytics and machine learning and AI, there's no reason for it not to be easier for a hospital or other organization to kind of take this piece in-house and offer these initial discounts and negotiations directly to their customers.
Stephanie, you've identified a need. You'd be surprised when you're dealing with some large medical institutions and some hospitals. We, as personnel, we sometimes try to pay the bills.
Yeah.
We actually can't give them the money. I can give you a lot of reasons. Big institutions, bureaucracies, some people don't care, large turnover, things like that. It's been an ongoing problem for years and years, made worse over the last couple of years. So if you can find the right people, the right persons in the decision maker, and take away, because it's not a pleasant thing, negotiating debt.
Right.
But the need is there. And sometimes you're trying to force money on someone and they won't take it.
Yeah, that's when I worked in healthcare finance, that was my job at the time was let's just try to find ways to improve our margins. And I thought, oh, this will be an easy win. We literally have patients calling us, trying to pay us.
Yes.
Let's just take their money and call it a day. But to set those kinds of parameters and then enable your frontline staff, and there just wasn't a way to enable our call center to engage in these one-on-one negotiations with thousands of people. And so that's one of the things Debtle, we knew we had to automate that and streamline it so that it was feasible.
Well, thank you very much.
All right, thank you.
It's an interesting concept.
Very interesting.
Yeah, thank you.